Good afternoon, everybody. My name is Rado Zakharieva. I'm Policy Coordinator for Health Inequalities and Roma Health at the European Public Health Alliance. Also, I'm coordinating the Roma Health Network, which is a public health community striving to achieve health equity for Roma. It is my great pleasure to welcome you today to this policy dialogue, marking the International Roma Day and the 50th anniversary of the first Romani Congress. During this 70-minute event, we would like to raise awareness and strengthen mobilization to tackle long-standing issues having devastating effects on Roma health and preventing Roma equal participation in social, economic, and political lives. I would like to ask you to use the chat box to raise your questions, which will be addressed during the Q&A session. Also, please use the following hashtags, Roma Health and International Roma Day, to join our discussion on social media. Now, I would give the floor to Sasha Marchand, Deputy Director of the European Public Health Alliance. Sasha, the floor is yours.
Thank you very much, Radost. Ladies and gentlemen, dear participants, as Deputy Director of the European Public Health Alliance, or EPHA in short, I'm honored to open today's webinar entitled Combating Inequalities in Healthcare, a first step towards health equity for Roma, which is taking place on International Roma Day. This day is, above all, meant to be a day to celebrate Roma culture and the many different forms it takes today, whether at home or in exile. So please accept my heartfelt congratulations, first of all. However, as a German-born non-Roma growing up in the 1980s, I often ask myself, did I ever learn anything positive about Romani culture in school? I recall having learned about Roma being among the victims of the Holocaust, and sadly, then Roma entered again my consciousness following the fall of the Berlin Wall, when neo-Nazi mobs torched down flats housing asylum seekers, including Roma. I still remember the feeling of numbness these racist attacks created for German society at the time, but I don't actually recall any discussions about the physical health of the victims, nor about the long-term psychological scars. I just heard a lot about Roma being passive victims, and despite a sizable community living in my city, it remained a closed foreign world to me. But whose world was really closed? Was it theirs or the one I grew up in? Why was it so difficult to conceive of Roma as active citizens, inspiring professionals and role models? Fast forward 25 years, maybe a bit more, and we're still merely talking about a first step towards health equity for Roma, reminding us that the ghosts of the past still linger. While the political and societal awareness of Roma health and social issues has grown as a result of initiatives such as the Roma Decade and the previous EU Roma framework, the overall picture remains grim, depicting a landscape of exclusion, deprivation, ill health, and early mortality. Given the many layers of discrimination Roma are facing, even in the good times, it's no surprise they are also among the groups hardest hit by the COVID-19 pandemic, which has greatly exacerbated systemic health inequalities. Not only has it become harder to access services and treatments, but the fundamental rights of many Roma have been severely restricted. Segregated Roma neighborhoods were closed off by the authorities. We've witnessed scapegoating of Roma, blamed for being vectors of the virus, and opportunities to earn even a meager living have vastly decreased. Thousands of migrant workers were forced to return to their countries of origin, as they were the first to lose their precarious jobs. Some Roma were even deported, and that at the height of the coronavirus crisis. COVID has disproportionately affected Roma suffering from comorbidities and unable to buy and cook nutritious food or engage in physical activity. Social distancing, accessing protective equipment, and following right hygiene practices is impossible in areas characterized by substandard housing, overcrowding, poor sanitation, air pollution, and numerous other environmental hazards in the immediate vicinity. The medical effects of COVID are compounded by a range of socioeconomic, environmental, and ideological factors. As our new vaccine equity campaign is highlighting, now that the vaccines are being rolled out, where do Roma communities stand? The overwhelming majority of national vaccination strategies overlook them, and few efforts are made to reach the most vulnerable. As many people are eager to travel again now, and public opinion is increasingly in favor of introducing so-called vaccination certificates, Roma are bound to lose out yet again, because restricting the mobility of those whose lives most depend on being mobile might be the case. Finally, developments such as the much lauded digital transformation of health and care are also bypassing Roma communities. And how could it be otherwise when you're living in a neighborhood that doesn't even have access to safe drinking water and electricity? And even if somebody does own a smartphone, digital health literacy is not something you learn overnight. Without guidance and tailored content, the digital revolution in healthcare will remain meaningless to vulnerable groups. The recognition by European policymakers in the post-2020 EU Roma framework that anti-gypsyism has far too long been one of the key roots of the problem marks an important step forward, also in the health sphere, as a specific form of racism encompasses deeply ingrained behaviors and thought patterns, from personal expressions of racism to institutionalized forms, resulting in inferior medical care and reduced access to early childhood education and care. Strong political will and equal partnerships with those directly affected is needed to break the cycle. So basically, events such as this can only play a minute role in combating health inequalities. The real challenge is to change everyday practices. Although Roma are merely one of the many marginalized groups IFA members are working on, many intersectoral factors apply to them, and anti-gypsyism adds an additional layer of exclusion. I dread to think of how stressful and humiliating it would be to always live on the edge, which is a completely normal state of being for many Roma I have met. We therefore rely on you, dear participants, and your individual agency networks and powers as policymakers, health advocates, community activists, or researchers to disseminate and amplify today's messages in your own words and languages time and again. Thank you.
Thank you very much for this powerful intervention, Sasha. As you mentioned, anti-gypsyism is not something abstract. It takes concrete forms and has severe implications on individuals and communities' health, both physical and mental, increasing inequalities between Roma and the general population. It is of utmost importance to assess and analyze the health impact of substandard living conditions, poor infrastructures, including poor access to water and sanitation in ethnically segregated settlements, in order to effectively address health inequalities that Roma experience across Europe. However, the process of data and evidence collection presents multiple challenges, and now Angelika Grabje-Wuche, a sociologist and program officer at the Fundamental Rights Agency, whose work focuses on inequalities in the areas of health, education, and employment, as well as poverty, will explain us how the Fundamental Rights Agency contributes to address the lack of data in health, especially in COVID-19, and the limitation we face. Angelika, the floor is yours.
Thank you very much for the kind introduction and the invitation to speak here. I will share my slides now. I hope you can see it. And it does again. As in the introduction already mentioned, FRA has collected data on the situation, the living and the working situation, the discrimination experiences of Roma for quite some time. We have it within our mandate to collect, record, analyze the data on fundamental rights issues in the EU. We were mentioned in the Council recommendations and the Council conclusions of 2013 and 2016. And we also developed a portfolio of indicators for the new EU Roma strategic framework in 2020, together with the Commission and the Roma working parties. The data collection continues since 2008. We are focusing predominantly on the largest populations in Europe, but we are also doing some research on how data can be generated and what works and what does not work in countries with lower or with harder to reach populations. For this presentation, I'm going to focus on the 2016 EUMIDIS 2 survey, which was conducted in 9 EU member states, and the 2019 Roma and Traveler survey in 6 EU member states. The 2020-21 Roma survey is now ongoing, and the data collection is in the field, but we don't have the results yet. The FRA Roma surveys are always based on self-identification, and they are using the Council definition, Council of Europe definition of Roma. So it includes also travelers, and it's used as an umbrella term for for a very diverse group. General findings of the survey that both were done before COVID. As we heard already, Roma are facing adverse living, working, and housing conditions more often than the general population. They are less often in stable working conditions, live in adverse housing conditions, very often in poverty and severe material deprivation, and they have to face discrimination and harassment. And we know that the living, working and housing conditions, as well as the access to good health services or adequate health services, are important elements for the good health and a long life expectancy. FRA compiled in the COVID-19 bulletin, which was drafted in September 2020, so after the first wave, that Roma and travelers are often disproportionately affected by the pandemic, not only because of the measures taken to contain the virus, but also because of the higher risk of infection due to their specific vulnerability. The measures chosen to contain the pandemic, which are basically national and local lockdowns, particularly during the first wave of the pandemic, hit the Roma population harder because of the higher shares of unstable and informal employment and the loss of these employments, which then made it harder for Roma to gain access to the welfare programs and the funding that came with that. And they also had to endure enforced local lockdowns, which were driven by prejudice and discrimination in several countries where Roma were, well, the lockdowns were framed as banning a health threat. They also face higher risk of infection due to adverse living conditions, particularly in segregated settlements, and because of their general health status. As I will show in the subsequent slides, the substandard housing and the housing deprivation, overcrowding, limited access to tap water within the dwelling, but also the generally poor subjective assessment of health status, and more limitations due to health problems in the Roma population are can contribute to this disproportionately effect of the pandemic. They also face limited access to health services and information about the pandemic. On the one hand, because medical insurance, because of insufficient coverage by the medical insurance, which the recent study shows that approximately 3/4 of the Roma state that they are covered by the national medical insurance scheme, but the number can go as low as 54% in some countries, and limited access to health services because of discrimination. Antiegyptism and discrimination is not something that is new or arrived with COVID, but it made it more dangerous in this sense. 27 out of 100 Roma felt discriminated within the 12 months prior to the survey in the EU9 member states. In the EU5 member states, which were covered in 2019, there were 45%, and 1 out of 10 Roma already before Corona was discriminated when accessing health services in the 12 months prior to the survey. And as the Fundamental Rights Survey of FRA shows, we have 46% of the general population that states that they do not feel or they feel totally or they feel uncomfortable having Roma as neighbors. With lockdowns and self-isolation being the main measures for containing the spread of the virus, Roma are affected are more seriously because they live in more often in deprived housing conditions than the general population. 61% in the EU9 countries, so in the EU-Midas countries, and 35% of the Roma in the Western European countries have live in an accommodation that has not enough daylight, damp walls, rot in the windows or floor, a leaking roof, or no bath, shower, or indoor toilet. And 1 out in 4 or 5 live in households which are affected by pollution, grime, or other environmental problems. And 78 and 48 live in overcrowded households. It's also very difficult to follow the hygiene regulation recommended by the authorities in case you don't have access to tap water within your dwelling. And without the numbers are approximately the same. It's like 38% of the Roma living in the EU9 countries that don't have a bathroom, shower, or indoor toilet in their dwelling. As we said in the beginning, that the living conditions, the housing conditions, and the working conditions have an effect on the health of the Roma. We can see that the Roma assess their own subjective health worse than the general population and report more limitations in activities that people usually do than the general population. The differences now at the first glance do not seem that big, but given that Roman travelers are on average younger than the general population, the differences are way larger than it seems when looking only at the averages. For the first time, FRA was able to estimate what this means in terms of life expectancy. And we've seen that on average, Roman travelers in the countries that were covered in the Roman Traveler Survey 2019 are living around 10 years less than the general population. To come to the end, generally we observed only a few improvements of the situation of Roma over the last decades, which aggregates the situation of the Roma during the pandemic, because the pre-existing struggles they have now shown to be making the situation even worse. We recommend to focus on the dismantling of prejudice through the cooperation and building trust between the communities at local and national level, and further work to minimize discrimination and the anti-gypsyism, invest in local level networks of Roma mediators to provide health, education, and social services to the communities, which we thought worked very well, but the structures and the networks that were there were very informal and underfunded, and understaffed and very fragile for that. There is an urgent need to intensify the work on equal access to basic services, a continued urgent need. And we would also would like to say that the new framework on the Roma inclusion, as well as the EU funds, provide a window of opportunity to implement the measures to overcome the disadvantages that Roma population faces, in order to also overcome the crisis caused by the pandemic. Participation at all stages from the Roma community, also in monitoring and the data collection, should be enforced, or not enforced, but should be encouraged. And Roma should be included in the development of the monitoring frameworks and at structure, process, and outcome level. Thank you very much.
Thank you very much for this presentation, Angelica, especially for presenting the results of the 2 recent surveys focusing on Roma and traveler socioeconomic situation. You have mentioned the FRA recommendations on building trust in public authorities, which is actually an essential factor for increasing the effectiveness of national policy measures aiming to tackle social and the social and economic effects of the pandemic. You have also mentioned the role of member states and public authorities in tackling discrimination and anti-gypsyism through national Roma-related frameworks, and the lower participation of Roma and pro-Roma civil society in the development of such frameworks. Structural discrimination is a long-standing issue that has existed before the pandemic. It has been greatly intensified during the pandemic. And if we don't have adequate measures, this issue will continue, and Roma will continue to face structural discrimination in the future. Therefore, it really requires sustained policy commitment, and national authorities plays a crucial role in this process. Now, Tomasz Kadar, Deputy Director and Head of Legal and Policy at Equinet, will address the role of national equality bodies for tackling inequalities in health, for advancing healthy and fair societies in COVID-19 and beyond. Tomasz, the floor is yours.
Thank you very much, Radost, and thank you for IFA for the invitation. It is really a pleasure to be here on behalf of Equinet, and it is a particular pleasure to be here on International Roma Day, so happy International Roma Day to all. What is not a pleasure at all is the topic and the findings that we have to talk about, because we should be way beyond realizing these problems, and real solutions should have been found already for these. I am going to try to share my presentation. Just a second. Okay, so what I'm going to talk about is indeed the role of national equality bodies and our findings on Roma equality, and what we have found particularly as regards health, access to health, and Roma equality in health. Equinet, just in a few words, is a network that promotes equality in Europe by supporting equality bodies for more equal societies, essentially. Our members are 47 equality bodies, which are public institutions set up on the basis of EU equal treatment directives. One of them being the first one that required the setting up of equality bodies, being the Racial Equality Directive from 2000. This was the first one that introduced the notion of equality bodies into all member states. But there is a huge diversity among the national equality bodies in terms of their size, the mandate, the grounds of discrimination that they cover, even though most of them do cover race or ethnic origin as a ground. and of course the structure and the experience and the powers they have. So we have massive differences in the membership, but I think what's important to see is that all equality bodies have a mandate, need to have a mandate to provide independent assistance to victims of discrimination, to prepare independent surveys and reports concerning discrimination, to give recommendations to policymakers, and also many of them do provide communication, awareness raising activities. They promote the value of equality. They also promote good practices vis-a-vis employers, service providers, including healthcare service providers. They also work with stakeholders, including, of course, civil society. They also act as an important and good link between government and civil society very often. And they also monitor and supervise the situation of equality in their countries. Now, particularly on Roma and traveler inclusion, we prepared a perspective, which is a report. Essentially, we call it a perspective with one of our working groups. And it is based on a survey that was completed last year by 20 equality bodies in 20 jurisdictions. So it doesn't provide a fully comprehensive picture, but it does provide a very good picture, I think, of what equality bodies see as the main issues of inequalities and of Roma and discrimination in particular against Roma. It was published in the summer of 2020. And we were actually very happy to have decided for this year to also focus on healthcare specifically, because this came very handy when Radost approached us to join this important event. So indeed, we are working with the same working group. We are working this year on a publication on the equality, diversity, and non-discrimination in healthcare. That is not focused specifically on the equality, diversity, and non-discrimination of Roma in healthcare, but it looks at the field of healthcare in general for all groups that are at risk of being discriminated. So on the basis of these two perspectives, I think we can put together quite an interesting picture of what equality bodies see as the main problems. Plus, we have also conducted important work on COVID-19, which I will also refer to shortly. So what are our key findings? Unfortunately, Angelica has already kindly stolen all or most of my points, but it shouldn't come as a surprise. And I think in a way, it just confirms that what FRA sees from their magnificent surveys and really large-scale data collection, that really comes back also from the experience, the day-to-day experience of equality bodies. And what we receive from them, what we see is that, of course, when it comes to healthcare, then there are certain groups that equality bodies have a particular focus on. One of these groups is definitely Roma, because they realize that Roma are facing particular issues of inequalities and discrimination in the field of healthcare. One of the issues is the lack of health insurance or even lack of documents that doesn't allow them to access healthcare. Another issue is the uneven geographical spread of health services. So that quite often is very detrimental to the health status and to the access to healthcare of Roma communities living in segregated areas, for example, or segregated settlements. They face just even very direct discrimination and harassment when they are accessing or trying to access health services. We see that. And then there are two particular issues that underline the important intersectional nature of the problem, meaning that certain groups, of course, Roma are not a homogeneous group. And within the Roma population, certain groups are even more affected than others. And in this case, what we found is that Roma women are particularly affected by segregation in maternity services and forced sterilization. of course, these are very grave violations of their equality and human rights. But we see that still happening. Equality bodies still report that as problems. Now, there are some other areas of concern which we found, and I think are important to mention, because you cannot look at healthcare in isolation. As Angelica underlined, I think, for example, the housing situation definitely has very important effects on the health situation of every individual. So the other three areas from the previous EU framework are pointed out, that all of them as having important concerns: employment, education, and housing. They are massive issues there, from segregation to direct and indirect discrimination and harassment in employment, and to housing segregation and housing deprivation. Underreporting. We don't even know what is the situation, and that is a big issue. Roma don't come to equality bodies or to any public authority for that matter, because of fear of reprisals, because of a lack of belief that reporting discrimination would change anything. And we need to address this, because this is a question of trust. And without Roma trusting the institutions, and of course, in our particular case, trusting equality bodies as useful allies and institutions that are there to serve them, we are not able to help as much as we should and we could be otherwise. Systemic, institutional, and structural discrimination. It's important to underline that this is not just one-off incidents. Discrimination is basically coded in the system, and everyone just accepts it. And I think that some of the findings from FRA also underline, or at least can raise some questions about certain communities, in certain countries, even accepting that as a fact of life, that they are being discriminated. So that has to change if we actually want to achieve change at a societal level. I already mentioned intersectionality, and I don't want to go into the details of all of these, but you see the list. Poverty obviously has important effects on health outcomes. Issues around policing, which can lead to physical harm very easily, or psychological harm for sure. The public discourse and of hate speech, and also just the fact that quite often information materials are not available in languages that would be understood by Roma, and I think that is also an issue. Moving on to COVID-19, and what we found in the past year is mainly that there aren't really absolutely new revolutionary things about what's happening, or completely new things in terms of the discrimination that Roma are facing, and in general what people are facing. But there are more, these are exacerbated by the crisis, by the pandemic. So we see that, and the equality bodies see that Roma already have a typically poorer health status on average than the general population, with underlying health conditions. That, coupled with the overcrowded and often poor living conditions, which Angelica also pointed out, makes it very difficult to follow strict hygiene protocols, and makes the risk much elevated for them because of the underlying conditions. So on one hand, it's harder for them to follow hygiene protocols, and on the other hand, if they don't do that, that can harm their health in a much worse way than for many others. Public health measures and warnings are not reaching Roma quite often. This is something I mentioned, that either the channel that is used is not a channel that is adequate to reach Roma people, or the language that is used is not adequate to reach them in terms of informing them about the public health measures and what they can do and should do to protect themselves. And we also see the existing socioeconomic disadvantages exacerbated by the economic crisis and the lockdown, which sooner or later will directly and indirectly will also lead to worse health outcomes if they don't have access to education, and they end up with much less prospects and perspectives for good employment opportunities, for instance. We also have a database on the Equinet website, which collects statements, actions, and complaints that equality bodies have done or have received in the course and related to the pandemic. And some of these which are related to the health and Roma health equality we saw that Roma settlements with substandard living conditions, no access to drinking water and disinfectants, which results in higher health risks. I already mentioned that. We saw some statements from equality bodies calling on the government to include Roma people in decision-making, including on decisions about public health matters. We saw enforcement by police of emergency powers disproportionately affecting travelers and Roma, which again included mistreatment and violence, which can lead to physical harm. Putting whole Roma settlements into quarantine due to only one person breaking quarantine regulations. Public statements stereotyping marginalized Roma communities, which also included a suggestion to restrict access to healthcare to certain groups, i.e. to Roma, that they shouldn't receive healthcare. And we also saw, some of our members also saw denial of access to services, including access to pharmacies, which I don't think I have to dwell on why it's important in a pandemic context. There are some important new entry points for policy. One of them, of course, is the EU Roma strategic framework, where one of the objectives is to focus on healthcare, and there is the objective of cutting the life expectancy gap between Roma and the general population by at least half, to ensure that by 2030 Roma women and men live 5 years longer. As we know, this life expectancy gap at the moment is 10 years. So that would mean cutting the life expectancy gap by at least half. But of course, this raises some questions about the level of ambition. And of course, we need to realize that we have to be realistic about what can be achieved in 10 years. But I think that we really need to move towards complete health equity, as is in the title of the event, and not be complacent when when we achieve a state where Roma women and men live 5 years longer than currently, which means that they only live 5 years shorter than the general population. Even that is completely unacceptable. To have a life expectancy that is 5 years shorter just on the basis of someone's racial or ethnic origin. Then there is the Council recommendation on Roma equality, inclusion, and participation, which calls on member states to ensure effective equal access without barriers to quality healthcare and social services. And there are, of course, also at the European level, there is also the European Pillar of Social Rights, of which out of the 20 principles, one of them focuses on healthcare. And there are also, of course, the UN Sustainable Development Goals at the global level. We organized a roundtable a month and a half ago in February, to discuss the implementation of these EU Roma strategic frameworks and how equality bodies can contribute to that. And these are some of the key conclusions from it. We realized and noted the appalling situation on the ground. We realized the need for strong and effective and enforceable rules, because currently the legislative framework is not wide enough and not strong enough and is not properly enforced. We realized the importance of linking up policy and financial tools, the importance of monitoring and measurement. The role of equality bodies, of course, was discussed in great detail, and how for equality bodies to play these roles, it is very important for them to have a proper level of independence and resources and powers to be able to contribute. And what they can do includes monitoring, including casework and research to put out recommendations, communication, training and awareness raising, supporting Roma participation. So there are lots of really interesting outputs, and just today we actually published our key conclusions and summary of this event, which is available on our website. So I urge you to encourage you to check that out. It's some really interesting findings. And my last slide, you'll be happy to hear that, is just some thinking about where we could go next and what we have to do next. I think first of all, and I want to make that the first point, we need to realize that equality is a founding value of the European Union. And that seems to escape many citizens and more worryingly also many politicians when looking at their actions. So we need to realize and implement equality as a founding value of the EU. I would suggest that this is also to a large extent a question of political will and the question of thinking long term and not only in short electoral cycles, and maybe taking some decisions and taking up some policies, introducing some policies and measures that might not be immediately politically lucrative. It is very important to implement the EU framework and to create and implement strong national frameworks. I would also suggest it is very important to take a holistic approach. The EU framework has currently 7 objectives: equality, inclusion, participation, and the 4 sectoral objectives of employment, education, housing, and healthcare. And these are all linked, as I already mentioned. I don't think that there can be real progress until there is progress on all these areas. So it is very important to look at all the areas in isolation, but also to connect the dots and to see that without proper education and ensuring equality in education, we cannot have in the long term health equality. Without equality in the field of employment, we cannot have health equality. And without making sure that people are included, there no one lives in poverty, we cannot reach the progress that we would like to reach. What was already mentioned is that financial means are available and they are a big opportunity, but we need to use them wisely, and we need to include EU funds, of course, in this context. We need to think about how to connect these policy tools with the financial tools and how to use them in a way that really contributes to Roma equality. And my final point is that we need to ensure that we work in partnerships, and these partnerships should include civil society and equality bodies, strengthening each other and strengthening the whole infrastructure that can underpin equality for all. Thank you very much for your attention.
Thank you very much for this detailed presentation, Tomasz. It was very interesting, and you're right, the issue is very complex and it requires effective cooperation, but also very strong policy efforts to holistically address Roma health, to close the gap, the health and social gap between Roma population and the general population across Europe. Also, thank you very much for highlighting the need of holistic policy measures, taking into account the 7 objectives of the Roma equality, inclusion, and participation framework to achieve any progress in strategic areas of life, including health. The pandemic intensified many social and economic issues, but also impacted the human rights protection of Roma people. Also, it reduced access to healthcare. We observed that in the context of lockdowns in member states, but also in candidate countries. We also see some limitations caused by the lack of data about COVID-19 contaminations, complications, and mortality rates among Roma, as well as their access to COVID-19 testing and COVID-19 vaccines. Now, Marek Silvashi, team manager Race, Ethnicity and Health Equity team at the Open Society Foundation's public health program will reflect on the importance of challenging these problems, and we also reflect on the perspectives of prioritizing Roma health in COVID-19. Marek, the floor is yours.
Thank you, Radost. Let me start with saying thank you and to European Public Health Alliance for this opportunity to speak. I'm very grateful to be part of this panel. At the same time, being the last one in the panel, being the last panelist makes you being in this role that you mostly echo other colleagues or gloss over those arguments which has been made. In my situation, also most of the points has been already said by Tamás and Angelika. So let me just gloss over and make a few more points. What COVID-19 demonstrated so uncompromisingly is the centrality of health, and I would even say public health, and specifically like non-medical elements to health, what we usually refer to as social determinants of health. Translated in, I would translate it as the standards of our communal, residential, environmental, and political surroundings. How these are crucial for our individual health status. I think the pandemic is making no doubts that this is what is happening, and the fact, as my previous predecessors argued, is that many Roma in most of the European countries experience substandard quality of the surroundings, which makes it, in the times of pandemics, makes it almost impossible or very difficult to follow essential public health measures like hygienic measures or measures on physical distancing. So the question is whether this substandard conditions would make a case for any kind of vaccine priority rollout position for Roma in Europe, and we would think, or we put forward a few months ago an argument that there are at least two reasons for considering such a vaccine priority for Roma. One is this substandard conditions in their neighborhoods, which the evidence which has been coming out mostly from US, United States, United Kingdom, or in Europe, Sweden, that racialized and ethnic minorities are being disproportionately hit by corona pandemics. And they, like in all these countries, differently formulated racialized and ethnic minorities are showing often 2 or 3 times higher rates when it comes to hospitalization, intensive care unit, or death. And why I'm speaking about the United States, UK, or Sweden is that the fact is that there are no such data on Roma, and this is we consider this as a big challenge for public policies in Europe, that we have the largest ethnic minority in Europe. We don't know what's happening in these communities when it comes to pandemics. So that would be perhaps one striking point that which I would urge is that we really urgently need to invest in collecting data. But I think this has been already said. What has been also said are, and I just repeated it, is the social determinants of substandard housing conditions. But it's not only the housing, but it's also like where the housing is located. It's really the quality of public spaces, environmental spaces. And here I would single out perhaps the one factor of air pollution, which there are studies and there are data about many Roma communities residing in the neighborhoods, in the parts of the urban areas with compromised air quality, and this has already been proven with the previous corona viruses like SARS, that it plays a very strong impact on the spread and intensity of the virus. So I would I would it would probably my second point is the focus on air pollutions, and when it comes to Roma neighborhoods. When I spoke about the disproportionate impact on racialized and ethnic minorities, I by no means I mean any genetic argument or argument related to medical or health comorbidities. Most of the studies, or all of them actually, argue that this is not because of genetical setting or because of some individual health characteristics, but it is because of the structural discrimination these communities in different countries experience. So my next point would be about that when we're focusing on disproportionate impact on diseases and for example, the corona has on ethnic and racialized minorities, it is because of the structural racism, not because of their biological predispositions. As I said, these were two main arguments why we put forward that there should be the government, the member state should consider some form of priority position for Roma communities when it comes to vaccination rollout. Unfortunately, we could not observe any response from most of the member states. There was some member states like Slovakia had in the initial versions of the vaccination rollout plans priority for marginalized Roma communities, but this has been written out eventually. Even from that, other countries considered Roma health mediators being part of the priority groups, like in Bulgaria and Romania, but the general population had not been considered. I think this argument is it's being lost in the time as the vaccination is progressing throughout the countries. What I would urge us to focus on, if we think about the urgent responses, is on one side, I would urge us to think about the paradox that we have one of the most affected communities being also the most hesitant communities when it comes to vaccination intake. And this has, again, something to do with the historical and structural reasons when it comes to, obviously, public authority responses or medical responses to those communities. I would also remind that this, when I say historical, I don't mean like going very, very deep in the history. It's been also like mentioned that the primary response in some countries to corona infections in Roma communities was a collective lockdown and repressive measures. And this obviously would not leave much space for trusting the public authorities when it comes to vaccination rollout. So that again, I guess that would be my other one point. The other point, and again, I think I'm just echoing the previous speakers, is focusing on equity in when it comes to therapeutics and vaccine at this point. Just 2 days ago, I read an article about the situation in Hungary, which is one of the most affected countries at the moment, where Roma communities have been disproportionately impacted. And one of the reasons why they are impacted is that the system of healthcare in rural settings, where many Roma would live in Hungary, just collapsed. The rural medical care providers are not in place. The ordinances and the places are being closed down. So when it comes to also vaccine rollout, this would severely have an impact on like whether the Roma communities would get an access or not. So I would probably conclude that this is not a matter of like how only to supply important medicine and vaccines to Roma, but it's in general what the pandemic showed us is the absence of I would call it effective equity institutions, like institutions which should secure that these important medicines and vaccines are being distributed in just manner. And this is a global challenge. We observe that in many other many other parts of the world, not only in Europe and European Union. So that would be perhaps my final point, that our focus should aim and improving or even building this important institutional framework for equitable distribution of health essentials. I see that we have a very short time for the discussion I saw in the program, so probably I would stop here and leave space for us to have some discussion. Thank you very much.
Thank you very much, Marek. You have raised very important points, and you also addressed very important topics such as vaccine hesitancy among vulnerable groups, which is much higher compared to the general population. Sorry. You also mentioned the disproportionate effects of the pandemic, which are rooted in existing inequalities affecting strategic areas of life, such as health, housing, but also employment and education. And now ensuring healthy recovery of societies and economies across Europe requires also to think about these long-standing issues and provide effective policy solutions to also address the gap between Roma and the general population. This time, Roma should not be left behind, and they should have also equal opportunity to enjoy healthy recovery after the COVID-19 crisis. Now we will continue the discussion. Actually, we will open the floor for some questions. And I hope that you can also address some of them, especially these concerning housing. We have a question from Frika Spinevij about Roma exclusion and Roma housing. I will read in the entire comment and question. And then you will have the possibility to answer. The way Roma exclusion is being addressed by and slash in the European Union is very much based on anti-discrimination approach. Discrimination and anti-gypsyism are, of course, key factors in the pathways into out of social exclusion for Roma, but it is only part of the picture. It can sometimes lead to an over-ethnicization of the solutions in areas such as housing and health. In my work, I have often heard Roma NGOs calling for Roma-specific housing, but I'm still struggling to understand how Roma housing is different than housing solutions for other vulnerable groups. I wonder if it would make sense for organizations working with Roma to team up more effectively with organizations that are not Roma-specific, but can still provide part of the solutions, which such as social housing providers. The challenges faced by Roma are often very similar to other groups, such as the lack of sufficient affordable housing. Making the solutions ethnic specific can make it more difficult to deliver them. What do panelists think about this? We have with us also Isabela Michalaki. She is a senior policy officer from European Roma Grassroots Organization Network. So Isabela, please feel free to take the floor and reply to these questions. I think that your inputs will be very important, especially on this topic.
Thank you very much, Radost. Yeah, indeed, it's unexpected that I would still be able to take the floor now, but surely if I can have some reflections on the questions related to housing. And yeah, I see that the person who has asked the question is basically saying that he's struggling to understand how Roma housing is different from housing solutions to other vulnerable groups. Yes and no, I would say, because while housing solutions are in general very similar, when it comes to Roma, we see that in some of the situations where, for instance, entire Roma communities would be segregated from the society with any lack of infrastructure. Municipalities would have to therefore come up with very inventive ways of and political will and funding to be able to address these issues, meaning place all these settlements within the urban, let's say, plans of the city, try and legalize these settlements. And many times you will see that the fact that Roma don't have housing, it's also they don't have documents. IDs, and then sometimes they don't have property documents. So it's a whole issue. There are so many combined aspects here that would have to be addressed holistically. So that's why I think that also, although we are speaking today about health inequalities, definitely it's important to see that this has a major link with all the other sectors, such as access to housing, particularly in the context of the COVID-19. So while, just to come back to the answer very briefly and very simplistically, while housing solutions should not have an ethnic aspect to it, they do have to take very serious the specificity of the various communities. And we haven't even entered the situation of traveling communities, gens du voyage in France or in other countries, where again their specificities would require governments to kind of stop these repressive ways of addressing accommodation. Right, in many of these countries, you would see that traveler communities are not able to have their own halting sites, are not able to allow to sit with their caravans. So therefore, it's not an issue that is generally present within that particular society necessarily. So that's why thinking out of the box, thinking in a comprehensive way, trying to address all the causes of the current situation, whether in housing or in health, I think it's really important in moving forward. I will leave it here because it's such a big conversation on housing, and I don't want us to focus so much on these issues while we are asked to speak on health inequalities, if that's okay.
Thank you very much, Isabella. We have a second question concerning the cooperation of national equality bodies with representative of Roma communities and Roma and pro-Roma civil society working on the ground. And this question is from a Roma activist working on the ground in particular. And this question is for you, Tomasz.
Thank you. Is it a question about the possibility for Roma advocates to participate in Equinet roundtables? Sure. We had this one roundtable, and as Equinet, we have a horizontal approach because most of our members cover multiple grounds. So we don't have the capacity to have a sustained focus of several roundtables every year, for example, on a specific ground on Roma equality in this case. But we tried to make an effort to make our best effort to include. It was a short 2-hour event. We tried to ensure the participation of Roma civil society. And we also tried to make sure that the invitation to the roundtable reaches Roma civil society. Of course, we can always do better, but absolutely the intention is there. The intention is there, and I think that as I pointed out, the cooperation between civil society and equality bodies was really one of the main findings. The importance of the cooperation was one of the main findings of the roundtable.
Thank you, Tomasz. The discussion is very interesting and pertinent. However, due to time limitations, we will not be able to take more questions. Now I'm pleased to give again the floor to Isabela Mihalache, working at the European Roma Grassroots Organizations Network, who will provide us with conclusion remarks from the perspectives of a major European Roma organization advocating for equality, effective inclusion, and participation of Roma. Isabela, the floor is yours.
Thank you very much again, Rados. It's really a pleasure for Ergo to be invited to this debate. And also I wanted to say Happy International Roma Day to all of you. We are so happy to see that today when many of us are able to celebrate our International Roma Day, many of us at the same time are engaging in various debates on policy developments at national and EU level on various aspects of Roma issues. Just before this event, I was in another event talking about the impact of COVID on Roma youth. So here we are now discussing health inequalities. I would also like to thank your previous speaker for their very relevant insights and the fact that they have engaged over the past year in data collection, which is tremendously important for us to be able, as different stakeholders, to provide evidence at EU level and at national level on how serious the impact of, for instance, the COVID pandemic has been on Roma communities at large. And here I would also want to contribute with the fact that also the Ergo network, which has members in around 20 EU and Western Balkans countries and Turkey, was also able to conduct a survey at the end of last year on this precise topic of the impact of the COVID-19 pandemic, including in the area of health and health inequalities. We were able to talk to around 1,400 Roma women and men, both from the EU and enlargement countries and Turkey as well. And our findings basically confirm, or if you want, sustain, support all the findings of your previous speakers when it comes to this particular aspect, the impact of the COVID pandemic, and reveals yet again that the pandemic exacerbated, as one of the speakers said, even furthermore, the social exclusion and the discrimination that Roma have been facing to date. And I would say that that even it becomes so very clear that that when it comes to Roma communities, they continue to remain so vulnerable to all these health disparities, but also to human rights protection, and particularly in this context. And we see that the gap between Roma and non-Roma, it actually grows deeper, also because of the social determinants such as poverty, inadequate housing, and we were just trying to address the previous question, a lack of sanitation, poor nutrition, and these high levels of discrimination and racism. Many of the speakers as well, and it's something where Ergo has focuses a lot of its work on policy at EU level on Roma and wider social and economic policies. So many speakers have already mentioned the Roma EU framework, right? And this coincided to some extent with the beginning of the COVID-19 pandemic. It is true that this framework takes into account and as Tomasz also mentioned, that it includes a sectoral objective on access to health, and it also looks at the impact of COVID. However, if we are looking critically at the EU framework, and we have also provided our written input, which is also available on our website. Now, fortunately, there are no specific targets to health or regarding health in general. The only target we have seen, it's the decrease of in life expectancy, which is also very important. And also we haven't seen these very relevant links to various sustainable development goals when it comes to good health and well-being, when it comes to clean water and sanitation, or even affordable and clean energy. We have seen, however, the reflection, or if you want, the suggestion or the recommendation to member states about the importance to create synergies with major EU policies, which is also a recommendation that we make. It's important that when we speak about addressing health inequalities and particularly the impact of the COVID pandemic, that we don't refer strictly to the EU-Roma framework, but we go beyond and we discuss also about the new Green Deal, the Sustainable Development Goals, about the European Action Plan Against Racism, the EU Recovery and Resilience Facility, the EU Plan Against Cancer, and so on, so that we create all these important synergies to be able to actually mitigate in practice all that it's considered impact of the COVID pandemic. Another reflection is the fact that from the previous experience of the EU framework up to 2020, we have seen that one of the failures of the framework was the non-inclusion of Roma and civil society organization adequately within policy processes, debates, but also monitoring of the implementation of the national strategy. And this is again one of the recommendations that we are making to EU institutions and national governments as well, and definitely taking the advantage to also work much closer with enlargement countries within the context of the Copenhagen criteria to ensure that there is enough political leverage for the countries to actually advance on human rights issues, including when it comes to the situation of access in healthcare. What I would also say, just to end, is that it is critical that over this period, we focus our attention at national level, not just on the design of the national Roma inclusion strategies and particular provisions that have to do with fundamental rights aspect and the fight against anti-gypsyism, both as a cross-cutting team but standalone, because it does impact on all the access to social services and rights in general. But we also focus on other major policies that are being translated as we speak at national level into action plans against racism. But in this case, regarding the COVID pandemic, governments are supposed and expected to provide by the end of this month in April their national plans for EU for recovery and resilience, which basically means that if Roma are not targeted and including into these national resilience plans, the funding for mitigating the impact for Roma communities is not going to be available over the course of the next 2 and 3 years. Having said that, if this doesn't happen, that means that we can expect in 3 to 5 years a major economic and human rights crisis in Roma and travelers communities throughout Europe, which will be very, very difficult to grasp with. So I think we are all responsible and have a moral and statutory duty, I would say, as well, to really make sure that we address every single aspect of life of Roma, and that when it comes to addressing health inequalities, we really look at the fact that we have to address all the social determinants that make it so that the health of Roma is so poor, and that of Roma to healthcare it's so poor at this point. This is all that I have to say. I'm sorry if I have taken too long, and thank you again for the opportunity you have given to Ergo Network to voice our concerns and our recommendation.
Thank you very much for this strong analysis, Isabella. I'm happy to have Ergo Network in this event. Before closing the discussion, I would like to thank all of you, our panelists, for your time, your efforts, but also your contribution to addressing health inequalities in that event, but also through your respective work, through your respective organizations and networks. I would like also to thank our participants for their questions, for their comments, and for their time. And look forward to continue this discussion on social media. Thank you very much. Have a nice afternoon. Goodbye.